everybody. If you're watching this video, it's because you are most likely a patient of our clinic, Mid-Atlantic Chiropractic Center, and hopefully you know three of us already, Dr. Amir Rashidi and Dr. Nicole Heatherly and Dr. Roberto De Sena. And a lot of you regularly ask me, who is a good medical doctor that I can go and see? A lot of you are big fans of the organic lifestyle, the drugless health solutions, that you want to be healthy the natural way, and that's why you turn to chiropractic for a lot of the things, and that's why you bring your families in and so on, and you want someone of like mind who can be your medical doctor, your primary care physician, your internal med doctor. And guess what? We found someone who's very special. That's Dr. Brendan Henderson. And I met with him a little while ago. We chatted, and I said, I really want to introduce you to our patients. And lucky for us, he's opening a practice half a mile from here. So lucky for you, lucky for us. I can tell you right now, he's already my family's primary care physician, and you guys are going to get to know him today. So we're just going to kind of let him introduce himself, and then we're going to have a little round table and ask him a few questions. And you guys can certainly post questions on the video, and we can answer those for you as well. And then hopefully we'll get you in touch with him. So tell us about you.
Well, thanks, first of all, Dr. Amir, for having me on your video cast here. I very much appreciate all your guidance and for you having me here. Well, basically, I'm an internal medicine specialist. I graduated medical school in 2006, Virginia Commonwealth University. I achieved honors in internal medicine, psychiatry, and other clerkships. And thanks to outstanding professors, I achieved some good residency interviews, and it culminated in choosing Yale as my residency placement. And that's basically the background of my medical academic career, so to speak. Cool. From a personal standpoint, though, my passion in medicine is really in the preventative medicine, whether it be nutrition, exercise, trying to do everything we can possibly do to avoid the medication prescription. There are some conditions that you need medication prescriptions for, but there are others that we can really pare down the number of medications used. So that's our goal.
Wonderful. My first question was, how did you like Yale, and how was it over there?
Yale was an interesting experience. Definitely a very challenging atmosphere. There were a lot of very competitive, physicians who are working to get the best placements post residency. I had a number of outstanding professors. I think I got an incredible education. A little bit different type of pace in the Northeast compared to Maryland, but overall a great experience. Thanks.
That's awesome. Very cool.
So tell us, Dr. Brennan, what makes your practice unique? Explain that a little bit more for us.
Well, the unique aspect of my practice is I really want to try to bring about the best type of quality care to the patient. Not just the medical care, but also in a customer service role. So there's really three features that make my practice unique. One is the direct primary care aspect. Second is beyond just traditional medical treatment. We want to offer additional courses in weight loss, diabetes remission, and even athletic training if you're so inclined to run a 5K. Or if you're just someone that's like me, 40 or over, and you want to stay in good shape and just be more fit and walk around in less pain. These are things that I want to help people achieve. And then the third thing is I really want to set our practice apart with our commitment to the greater Frederick community. I plan on rolling up my own sleeves and getting out there with you to do some of these things.
Awesome. So one of the things you had mentioned in there that makes your practice different, you said you offer direct primary care. So can you explain to our patients what that exactly means?
Yes, thanks, Dr. Nicole. Well, basically, direct primary care is a healthcare delivery system that's unique compared to traditional healthcare. Basically, traditional healthcare, you either have an insurance plan or Medicare kicks in for primary care. Really, there's not that much expensive that happens in primary care. It's office visits, it's meds, it's labs. It's X-rays and MRIs. And the thing about direct primary care is it's a unique relationship between just the patient and the physician. So basically, there's no other entities that have an interest except for the physician and patient. So it gives a great opportunity for extended medical appointments, better access to care. So what we're trying to get away from is you need a medical appointment, you need to wait several days to several weeks to get it. You get to a crowded office, you wait for 30 minutes, and you see the doctor for 8 to 12 minutes. So we offer same-day appointments or next day at worst. We offer extended conversational visits rather than just the physician's checklist. And then, finally, we offer longer appointments and better access to care.
Okay, awesome. So I think your model is very similar to what we do. We don't take insurance, and I think what you're saying, which is one of our big reasons for not taking insurance, is that we want to work for you guys. We want to work for the patients, not your insurance company. Someone sitting behind a desk who has no idea about your health. They're just dictating what they'll pay. So really, that's why we do it. We want to work for our patients. That's why they come to us.
Absolutely.
So.
It's really all about providing the best care. And if your practice is dedicated mostly to seeing the patient rather than collections, billings, insurance compliances, Medicare rules, you can really deliver a much better product.
That's right. A lot of money gets wasted on those things, and we can pass those savings on to you. Speaking of that, is a lot of times I think people think that if you go to a doctor who doesn't take insurance, they're going to end up spending more money. But the truth is actually they save money in the short term and in the long run. And if you can expand on that.
Sure. So the great thing about direct primary care and any direct billing system is, again, the unique relationship between provider and a patient or individual. A lot of physicians who do direct primary care have direct relationship with pharmacies, with labs, with imaging offices, where we can get wholesale prices for those things. So, even if you're paying a monthly membership for your medical care, we can often save a good portion of that just on your medication lab or imaging costs. But I think what you're really referring to, Dr. Amir, is the long-term numbers. So different statistics say different things, but one thing I read recently is $280,000 is the amount that each individual pays in retirement for their healthcare costs.
Wow.
So direct primary care has been shown to reduce significantly that expense by 30 to 60% depending on the study.
That's amazing.
So if you can prevent these things from happening in the first place through better preventative care, then you can save money later on and have a better retirement as well.
Well, speaking of retirement, you mentioned something that I really like and I believe in earlier, and it may be something that most people don't believe is true or it can happen, and that is diabetic remission, right?
Yes.
Most of our patients are going, no, I am a diabetic. It's an identity, and it goes, these are the pills I have to take, and this is how I have to control my sugar and my insulin and everything else. But we know, the four of us at least know, have seen with experience, and you the most, that you can send into remission. In fact, the reason we use maybe remission is because legally we're not allowed to say heal. I mean, bottom line, just being really frank, and I'm not putting words in anybody else's mouth except myself, is really, what's the difference between healing diabetes and sending it into remission? There was a study, I think it was in Canada, where they put a bunch of people who had diabetes on this plan, and all of them, their diabetes disappeared, and then the government, the Canadian Diabetic Association, went on the media and said, oh, no, they're not healed, because if they go back to their old lifestyle, it'll come back. So they're in remission. And I go, well, maybe they don't want to go back to their old lifestyle, because that's what got them to diabetes in the first place. But what is remission? And tell us your approach, because there's a lot of people who are interested.
So this is definitely one of my passions. A lot of interesting statistics behind diabetes. So first, in the year 2000, 1 in 3 women and 1 in 4 men born will get diabetes during their lifetime.
Wow. So
this has become an epidemic condition. And there are some things that put you at much higher risk for this. There are some genes that just can't be escaped and things like that. But a lot of it is under our control. or at least we can delay the onset of this till much later in life. So diabetes remission is one of my biggest passions in medicine because it combines a lot of things that I'm very interested in. One is physical activity and physical fitness. Number 2 is nutrition. 3 is weight management. 4 is just getting people off medications. So with diabetes and diabetes remission, we can simply get you on some type of regimen to help you get off these medications. One of the simplest things you don't even need my help for, but a recent study, well, it's probably not as recent anymore, but it was published and it showed that if you exercise, which just includes walking, just 30 minutes 3 times a week, and you're pre-diabetic, your chance of progressing to diabetes is 59% lower, even if you don't change a single thing. So if you're like me and you like to eat some candy or some pizza from time to time, moderate that, which I do. But just a simple change like that. It's not about being perfect with your diet. You still want to be pretty good with it, but that's one easy thing that I think is achievable for most. Now, one thing that I really like to focus on in my practice is an exercise regimen for everyone that's individualized. So as someone who used to run in college, I tore my ACL, I had a hamstring tear, I had a broken foot, thing after thing after thing that kept me away from my athletic goals. But trying to find ways around them to remain healthy is something that can be achievable.
Awesome. So other than the diabetes remission and the weight loss counseling, what other types of services do you offer at your practice? Well,
a third related one is an athletic training, which I think is very unique among internal medicine doctors. So basically, it's just something if you want to do a 5K or a half marathon or a marathon. As a former high school runner and college runner, I really have a great background in helping to train people for these. I've been very fortunate to have outstanding coaches who have coached people to national championships, All-American status. Wow. Now, those are people much more gifted than myself, but these folks were great at getting the most potential out of each individual. And I've gleaned a lot of their training strategies over the 20 years involved in running. And that sort of training I can really help with. What kind of training can I help with? Well, number one, if you're looking to bench press 600 pounds, I'm not your guy. The American Heart Association basically says any amount of heavy weightlifting is actually bad for the heart. So when I was 20 years old, I lifted heavy weights for my size. I no longer do that. I lift light to moderate weights in accordance with the American Heart Association's recommendations. So weight training will be part of the regimen if that's something you're interested in, but it will be to develop lean muscle mass rather than bulk. Because not only for the heart, even for joint replacements, etc., no matter how much weight you carry, basically that will put you at higher risk for a joint replacement or something like that down the road.
Seems like the extreme in any sporting event or athletics, in bodybuilding or powerlifting, the extremes are, in the long run, don't seem to be very healthy for you.
That's true, and for someone like me who's in his 40s, those days are over at this point. At some point you have to get more realistic with your health goals. So it's all about staying healthy rather than, we will help you to achieve your athletic performance, but not at the expense of your health itself. So
aside from the super athletes at home, describe to us your ideal patient in practice.
Okay. So really, I enjoy all types of patients and medical conditions to treat. So, the chronic medical conditions, whether it's COPD or heart disease, these are things that I enjoy treating very much. And I can apply a lot of these things we've talked about to those conditions. Can I put a heart condition into remission? Probably not. Can I put COPD into remission? No. But I can probably help you with your everyday quality of life and being able to walk with less shortness of breath and things like that. But my true passion is really finding someone who's on the cusp of disease or someone who just wants to remain healthy long term. So basically that's where the exercise, where the nutrition guidelines and other things really come into play.
We have a saying that says, early detection is not prevention. But unfortunately, it just seems to be a common cultural norm where you go, oh, as long as I get my mammograms, I'm preventing breast cancer. I don't think you are. You do nothing to prevent breast cancer. But doing the things you're talking about, That's when you prevent breast cancer. That's when you prevent heart disease. I had a patient when I was an intern, used to come in for chiropractic care, but they had removed 85% of her lungs. So she had 15% of a lung compared to the rest of us, and she was still functional. And I'm looking at that going, this is incredible what the human body has been created to be able to adapt to. If someone can adapt to live on 15% of lungs compared to us, what else is possible? I have patients now who have 80-90% blockages in their arteries, and they're still functional, which is, again, it's being able to adapt to what's going on, which is what you can help them with, and prevent that 80% to go into 90 or 100. And seeing, I mean, there is cases, documented cases, where plaquing actually got reduced. As long as you're doing the regular walking and the eating the anti-inflammatory, good nutrition. You know, I was talking to a few other medical doctors, and I asked, what nutrition classes do you get in medical school? And they said it's very simple. It's like 3 or 4 things. Don't give sugar to the diabetic. Don't give salt to the guy who has high blood pressure, and then eat less to lose weight. And you know, it's like, that's it, because that's all we get. You know, the rest of it is pharmacology and learning how to use the chemicals to manipulate the chemical processes inside the body.
No, you're right, Dr. Amir. I mean, early detection is important, but you're right, prevention is really the key. So we want to identify everybody's at risk for disease. So if you're perfectly healthy, we want to prevent those things. If you're in the check engine mode, where your blood pressure is creeping up or your blood sugar is creeping up, this is an ideal time to say, let's nip this before it becomes a full-on chronic disease.
That's we preach on this all the time, right? When should you call the doctor? You know, when
not after the symptoms come up.
Exactly. Not when you're in crisis. And who better than someone who can coach you, monitor you, guide you, you know, and that's what a primary care physician should be. It shouldn't be the person that you don't even know. You don't know them, and you see them for 8 minutes twice a year, and really all they do is they come in and say, okay, your vitals look good, or you know, hey, you need to stop eating sugar, and they walk away. You need someone who can coach you, and that's something, if you could tell us about, is tell us about that coaching model, and how especially you mentioned athletics and athletes, and your experience as an elite athlete, coaching, and how important that is in the medical model.
Well, thanks, Dr. Amir. As an athlete, maybe not elite athlete, but I definitely appreciate it. But yes, in college athletics, you know, it's like anything else. If you want to achieve a goal, it does take some hard work, and it also takes some great coaches. So that's basically what I've had all the way through, whether it's in athletics or whether it's in my medical training. And these experiences have really translated to my life today. For instance, my academic professors, these folks took interest in me just not as a student, but also as a person. So it inspired me to take on a number of different sort of volunteer titles throughout my life. Starting in high school as a 15-year-old Eagle Scout, moving into college and being a first-year peer mentor and teacher's assistant for college students, and doing the same thing with medical students to help teach you know, clinical skills. In college, working as a resident assistant, in medical school, mentoring pre-med students and having them shadow with me, working at homeless medical clinics. You know, and then as an athlete, just having outstanding coaching and working with these folks to achieve the best that I can possibly achieve, which it did allow me to be a captain of a couple teams and even set a college school record. These are the things that really helped me, and I want to pay this forward by really finding the right types of folks who are motivated as well to succeed. I also want to continue to pay this forward in the Frederick community by mentoring pre-med students. If you're looking to be a nursing student, a CNA, whatever in the healthcare field that you'd like to come in and shadow, we'd like to help. And you know, also getting out in the community with everyone. So once we get established, we'll have at least monthly outings, whether it be just a walk in Baker Park, or whether it's a run with some other, patients, or if it's a yoga class or nutrition class or something on site or out of the building, to get involved in the community and bring some health activities out there. So these are the things I want to bring forward.
Speaking of the Frederick community, is there a specific reason why you chose Frederick, or do you think there's a health crisis here? Do you think there's a problem that needs to be solved?
There is an opioid crisis.
There is. That's what.
No, that's definitely true. The health crisis is really, you're right, it's sort of everywhere. Frederick, for me, my wife is from the greater Frederick area, Emily.
Awesome.
So she grew up in Middletown, just 5 or 10 minutes from here. So we're settled as a family here with our 3 children. So I've been in and out of the Frederick community for 10 to 15 years. I actually grew up in Harford County and went to school in Baltimore County, but we're settled in this area now with her, and it's nice to have family in the area and people in the community that we know.
That's awesome. So Dr. Amir had mentioned the opioid crisis, and
yes.
You had said your favorite patient was someone on the cusp of disease or someone who doesn't have any disease yet. But let's just say I'm a patient walking into your office and I'm on a ton of drugs. Can you explain your philosophy with someone like that, or what your goals would be? Or
Sure. So, for drugs that treat medical conditions, really the goal is sort of to get people off as many of these as possible. And a lot of these can be removed with moderate effort. So, if you're diabetic and you want to get off the medications, like we discussed, just simple exercise, some nutritional changes can help. Blood pressure, same thing. These are things that if we can make some subtle changes here and there, that we can get you off these medications. Some medications you might need to take a long term, and that's considered the best of bad options in some cases. But if you have COPD and it's stage 4, we will probably have to continue some of those medications. But we hope to achieve a better quality of life, being able to walk further without shortness of breath and things like that.
Okay. In your practice, do you typically work not side by side, but as far as your referral network, do you work with, chiropractors, physical therapists, or people who take more of a holistic alternative approach?
Yes, I think holistic approach is the best approach. I'm trained in traditional medicine, and that is my fallback. But what I prefer to do is just treat this without medications as much as possible with the things we talked about. So, from my own personal experience, at 28, I tore my ACL. I really had to make a choice. Do I want to rehabilitate this injury, or do I want to have surgery and be out 6 to 8 weeks on this injury? And I chose to rehabilitate the injury through physical therapy and manipulations and things like that. And it worked. I mean, I'm not quite as mobile as I was before the ACL, but I can still exercise and do some of the things that I like to do. So definitely, holistic is definitely the way to go. There are some things where medications become the best of bad options. And I can't honestly say I'm 100% holistic, but it is definitely the approach that I want to use. Again, getting away from the 8 to 12 minute medical appointment and shifting to a half hour to 45 minutes to an hour, if we need it, to really talk you through the medical issues that are, and societal issues even that come into play. I've named it modern internal medicine because there's so many modern conveniences that are affecting our healthcare today. Whether it's an overabundance of, non-nutritional foods, the smartphone, social media, the internet, an abundance of viewing options on our tablets. These are all things that provide some enrichment to our lives, but can also take over and get in the way of our health. So that's really where the modern internal medicine part comes into it. Trying to achieve health in a modern society with a lot of distractions that weren't with us 50 years ago. While at the same time, I want to provide that old-fashioned doctor-type care that we did 50 years ago, where it wasn't, all right, here's my checklist as a doctor, here are your medicines, we'll see you in 3 weeks, or 3 months or 3 years. I just want to have a conversation and listen too.
Yeah. My definition of holistic is we treat people with a whole list of problems, holistic.
Which most of our patients have a whole list of problems.
It's usually multifactorial anyway.
Exactly. That's how I define holistic. And you prefer to help families get healthy because individuals, if they go back into a sick environment in their home, then and you and I had a conversation when we first met about children and so on, and I know you're not a pediatrician, right? But you can help parents be healthy and get healthy, and then they can make sure they're raising their children properly and healthy as well.
Yes, I mean, like we talked about, do I watch movies with my family from time to time? Of course. You know, we sit down, watch a movie, but we also spend some time getting out for a 30-minute walk as a family, going and kicking the soccer ball around. This isn't about achieving world-class athletic status. Right. It's just about getting outside and being active, and you know, just getting outside, as we both know, can be very healthy.
Absolutely.
So yes.
So we keep talking a lot about health, Dr. Brendan, and we find that in our practice, especially, most people think health is the absence of disease, and that is not our philosophy at all, and it sounds like that's not your philosophy either. So how would you define health? What would you say health is for someone?
Well, as far as health is concerned, absence of disease is a good start, right? But it's nowhere near what we're trying to achieve. So basically, health is the ability to function in every day as comfortably and as carefree as possible. That's sort of my idea of health. So, you know, this goes much beyond what we typically do in medicine, like blood pressure. It's 145/95. We need to get that down to 120/80 or less. Very easy, right? But there's so many other things we should be talking about. Lifestyle habits, stress management, relational situations, how you're interacting with others. There's so many things that play a role in getting to that blood pressure besides just giving a medicine first.
So it sounds like your role as a patient has faced and prepare you for your role now as a provider. Can you explain for our patients at home how that has affected you and what that's done for you?
Thanks, Dr. Roberto. Yes, so yes, 20 years ago I was able to go out and run 6 to 8 miles, and it was great and I enjoyed it. But then one day I was playing softball and I tore my ACL. And since that day, it really has affected my gait. So, you know, if I jog, there's a little bit of a limp with the jog. But the thing that's helped me the most is using, you know, a holistic approach to returning. So I work with a physical therapist, and they gave me the exercises to do so that after 3 months I was walking without a limp. You know, 3 months later I could run without a limp, and then 9 months later I could run in a straight line almost as fast as I could before. But it gives me the perspective as a patient and not just a physician, because it can be frustrating trying to rehabilitate an injury. And one of the things that helped me was being in good shape before the injury. And that's really what I want to do for my patients. If you're someone like me over 40, you know, at some point you're going to be 60, and if you have a hip fracture or at 60, 70, or 80, you want to be in your best shape possible, whatever that is, when you go into that, so that you can rehabilitate that injury and continue going on.
I ask people regularly, what's it going to be like when you're 100? And they go, I don't want to live to be 100. I go, that's only because you're not 99 right now.
And also, how long you live is not a choice. You know, I commonly hear from patients all the time, well, you have to die somehow. So why not eat this, you know, McDonald's cheeseburger and large fry and drink a soda? You're going to die somehow, so choose your poison. Well, you don't get to choose how long you live. Right? So would you rather live a long quality of life, have a long life with a good quality of life, or would you rather continue to make unhealthy choices and maybe towards the end of your life live a really sad, miserable life because of the choices you made earlier on?
Right, you both make great points. I mean, if we can get to 100 and feel like we do today, who wouldn't want that?
That's right.
I mean, there is some inevitable decline as we age, but a lot of this can be prevented. So again, putting ourselves in the best position to succeed later is what it's all about right now.
Right. So here, the bottom line is this, everybody, that we all need a coach, and who'd be better than someone with medical experience, personal experience, coaching experience, life experience, someone with a family. That's why we've chosen him to introduce to you. Of all the medical doctors we know of, everybody we interact with, this is, and you know this, the only time we've ever done a video where we introduced you to an internal med, a primary care physician. It's because we believe in his powers, his abilities, his focus, his love, and passion for serving and helping you guys. So that's why we brought him here. And the last thing I want to say is laughter truly a good medicine?
It's
Thank
the
you,
best
absolutely.
medicine.
So we'll even coach you in laughing. So thanks for joining us, and if you have questions, post it. We'll give you information on how to contact Dr. Brendan Henderson, and we'll either put it on this video at the bottom, or we'll add a segment to this video so you know exactly how to contact him. And you can always call our office as well, and we'll help you put you in touch with him. So take care, and we'll talk to you next time.
Thanks for watching.
Everyone.